This YouTube channel contains content related to forensic science, which may include discussions of violent crime, autopsies, death, and other sensitive subjects. Some viewers might find this material disturbing or distressing. Viewer discretion is advised. This is Sisi, also called Elisabeth of Austria-Hungary, Empress of one of the most powerful European empires at the time. When she was stabbed in the heart on a summer day in 1898 by an Italian anarchist, she didn't even realize it. Apparently, she was able to walk more than 120 steps, boarding a boat and talking with her maid. How was that possible? And was she able to survive? That's what we are going to find out today in Forensic Archives. When Elisabeth was stabbed by Luigi in September 1898 in Geneva, Switzerland, it was a hasty and unplanned murder attempt. Luigi, an Italian anarchist, stabbed Empress Elisabeth to protest against the monarchy and promote his anti-establishment ideology. He believed assassinating a royal figure like Elisabeth would draw attention to his cause. His plan was actually to murder a French aristocrat. When he found out Elisabeth was visiting the Swiss town incognito on one of her many travels through Europe, he didn't have much time to prepare. A quick look at an anatomy book and a self-made sharpened file had to be enough. He later said that he thought a dagger or a gun would be too expensive. He attacked her while she was taking a walk at the river promenade together with her maid. The 8.5 centimeter deep stab wound pierced her left lung lobe and the left heart chamber. However, Elisabeth quickly got up from the ground after the attack, brushed off her clothes, and went on like nothing happened, apparently asking her maid if what just happened was a failed robbery attempt. The two women then walked roughly 91 meters to the gangway of a cruise ship and boarded. At that point, Elisabeth collapsed. Bystanders could only notice a few blood drops on her corset, with no apparent sign of injury. Elisabeth was unconscious at that point, but still alive. People thought she suffered from a heat stroke, so she was quickly brought back to her hotel room, regaining consciousness a few times, still asking about what actually happened. 2 doctors arrived in short time, along with a priest. Unfortunately, it was already too late for Elisabeth, who was pronounced dead at 2:10 p.m., about 1 hour after the incident. Luigi was caught while fleeing the scene, and authorities discovered his sharpened file the following day. He admitted to being an anarchist and said he came to Geneva with the intention of assassinating any ruler to make a statement. His trial began in October, and he was enraged when he found out that Geneva had abolished capital punishment. Luigi wrote a letter demanding to be tried in a different canton, hoping for a death sentence and martyrdom. Instead, he received a life imprisonment sentence. On October 19, 1910, 12 years after the murder, he was found hanging in his cell. His head underwent phrenological and pathological studies to determine if there were discernible differences between the brains of murderers and non-criminals. No differences were found. The head was kept in a glass container filled with formalin at the Forensic Institute of the University of Geneva and was said to have had a particularly grotesque and deformed expression. In 1985, it was taken to a museum in Vienna. The story of Elisabeth's life and her subsequent murder has been depicted in many stage plays, films, and books. Luigi's childhood memoirs were published in 1998. So, how was Elisabeth able to survive so long after getting stabbed in a vital organ like the heart? Would she be able to survive nowadays? For that, we have to take a look into the anatomy of the heart. The heart is a powerful 4-chamber pump with 2 sides. The right heart collects the venous, so the deoxygenated, used up blood of your body, and pumps it into the lungs, where oxygen is added. The oxygenated, fresh blood is then collected in the so-called left atrium, pushed in the left heart chamber, also called ventricle, and from there ejected through the aorta, the biggest human blood vessel in the whole body with high pressure, supplying us with the oxygen and nutrients we need to survive. The heart's valves ensure that blood flows in one direction, preventing it from going backward. Also, the coronary arteries are the first blood vessels branching from the aorta, supplying the heart itself with blood. When Elisabeth was stabbed with a pointed file, a very thin and long weapon, her left heart ventricle was punctured. Now, we know that the left ventricle is the part that actually propels the freshly oxygenated blood through the aorta and the whole body. Therefore, it's one of the most muscular parts of the heart. The The powerful contraction of the left ventricle muscle, the so-called myocardium, actually helped Elisabeth survive longer, as the high pressure and thick wall of the heart prevented too much blood from leaking. Only when relaxed, so between heartbeats, a few drops of blood would spill out from the heart. Additionally, Elisabeth was known to wear very tight corsets, thus increasing the pressure even more, making it hard for the blood to spill out from the heart. Ultimately, she died of something we call pericardial tamponade, though. The heart is surrounded by a thin layer of skin, called the pericardium. You can think of it as the heart's packaging. When the heart is punctured, injured, or inflamed, fluid or blood can spill into the space between the pericardium and the heart muscle. In Elisabeth's case, with every heartbeat, a few drops of blood would spill into the pericardial space. Eventually, the fluid pouch will be so big that it actually constricts the heart muscle in its own function. Less and less blood gets pumped to the brain. You become unconscious. Then it's only a matter of time until fatal cardiac insufficiency or cardiac arrhythmias occur. So how can you survive that? Well, if you are able to reach a hospital fast enough, doctors can do something called pericardiocentesis, where you basically put a surgical needle in the pericardial effusion and suck the blood out. Following that, you can then access the heart directly through the chest wall in open surgery, called thoracotomy, and sew the stab wound. During the surgery, the heart needs to be stopped so that you can work on it. This is done using a method called cardiopulmonary bypass. Essentially, the venous blood, the deoxygenated blood that is going to the heart, is drawn from the veins before reaching the heart. It then gets oxygenated by a machine and is pumped back into the body behind the heart, effectively bypassing the heart and lungs. To actually stop the heart from beating during surgery, though, we have to use something called cardioplegic solution. That is a 4 degrees Celsius cold solution with high potassium levels. The high potassium levels stop the heart muscle cells from producing electric signals, while the cold temperatures ensure that the metabolism level of the cells is slowed down to a minimum. This gives surgeons the time they need to work on the heart. Complications include infections, post-surgery arrhythmias, and sometimes strokes, mostly from not enough blood reaching the brain. Myocardial infarctions can occur if a coronary artery, the artery that provides the heart itself, is severed by the stab wound. Penetrating trauma to the heart is rare, and not always associated with knives. There are cases of people using screwdrivers, ice picks, and even a case of someone getting stabbed in the heart by a stingray and surviving it. Ventricular perforations are actually less fatal than atrial perforations. The thick muscle layer of the ventricle ensures that blood spills more slowly from the wound in the pericardial room, giving the victim more time to reach a hospital. So, in conclusion, you can say that Elisabeth would have had a chance of survival nowadays. Overall survival rate of penetrating heart trauma nowadays is around 33%. Modern medicine is a miracle, and we can treat the most severe injuries nowadays and make miraculous recoveries.